Hey everybody, this is Erica Mello, and I wanted to thank you for listening to our podcast and subscribing. We've really enjoyed doing it, and we appreciate all of your feedback. This podcast today, Susan and I discuss a really interesting case of a young boy who had some unique leg pain. I actually had treated him on prior occasions for some knee pain, and everybody, including the physicians and the parents, thought that this kid's knee was the problem. And listen to the podcast and you'll find out it actually wasn't the problem.
Hi, everyone. It's Susan Clinton and Erica Mello. We're here with our next podcast. Erica is up this week, and she's going to share a very interesting client with us. So, Erica,
yes.
Whenever you're ready.
Hey, Susan, I'm good. And well, let's get right to it because I've actually seen this patient. He's actually a young kid. Well, I know the kid, he's like 12 years old, but I've treated him before. And I'll give you a brief background on him because this is his second sojourn into my facility. He initially came to me with knee pain, just basic knee pain, and he couldn't really run. And he was actually 11 at the time that I saw him. It was his left side. And, he couldn't do stairs, he couldn't squat. That was initially that was probably a year ago, as I said. So anyway, I ended up not touching his knee, and I treated his thoracic spine as well as I did some neurodynamics for the femoral nerve and obturator nerve and had him do some novel movements. So given that background and knowing his age and a classic knee pain, you would think that it would be maybe like, Osgood Schlatters growth plate. He's 11. He hadn't grown.
Exactly.
Right, Susan? Right. It wasn't the case. And he was very point tender, patella, quad tendon, things like that. And he was extremely, extremely sore when I just sort of did basic PAs on his thoracic spine, just in the evaluation, just testing, because something didn't seem right with him. So based on that presentation, not really touching his knee, doing neurodynamics and thoracic spine, manual therapy, he got better. Okay, so he's good for a year and a half. He comes back probably I'm still treating him. I've only seen him twice, so this is quite interesting. And I would love some feedback. He came to me a month ago with actually same-sided pain. And it was in his knee, but it was down his hip, from his low back, his hip into his leg, which the physician who sent him to me wrote knee pain. And when he came to me, he said it wasn't really his knee. It was sort of that whole left side. The aggravating factors for him were stairs and standing, and at the end of the day, what made him feel better was walking on his toes. So he came in with his left heel in the air and walked. I feel good. I said, but you can't walk like that, right? You're going to have tight calf. So I said, put your foot down. And he's like, my hip and my leg hurts. I'm like, okay. 12 years old. This is kind of not the normal run-of-the-mill things for someone that age group. I mean, I don't know what you think, but it was a little bit of an odd presentation. But knowing his background didn't surprise me.
He didn't walk on his toes last year, did he?
No.
Okay, so yeah,
it's just his
walkers. Yeah, if it's a neuro toe walker thing, they usually start as little children.
No, he was good.
Doesn't start presenting at 12.
I know, right? So
but
it was just his left foot. So he alleviated the knee pain by lifting the heel. So I'll give you the background on why. So he was pretty much doing well. He went to Greece in the summer for 2 to 3 weeks, walked around in flip-flops, felt fine. He ended up getting a role in a summer camp production, the High School Musical. So I don't know if anybody has seen High School Musical, but he played Sharpay's brother, where he stands up in the front and he ends up bending one knee and jutting one hip out, but he only did it for like 2 weeks. But according to his mom, he practiced every day in the same position and that right knee bent, left hip jut thing. So he felt okay. Then he ended up going to a fair out here in Montauk, Long Island, where he stood in flip-flops for 10 hours with his left knee bent and his right knee bent, shifting weight the entire time because he didn't want to stand straight. 5 days later, his left leg started to bother him. He said he had mild numbness in the calf. I don't think that was so much of a big issue, to be really honest. So that's the issue. He went to the orthopedist who cleared him of anything. They did an x-ray and they didn't really find anything. So that's his presentation. So the left heel thing kind of got me a little, not bothered, but a little frustrated, because he said, I'm going to walk around like this all day. I said, you can't do that because it's just going to feed into another issue. The main objective findings that I found was when I actually started to fix his foot and put it down, everything was worse, which makes sense.
Mm-hmm.
When I had him do in standing, I just said, let me just clear lumbar because I think this may be partly spinal related. I had him do a forward bend, made it worse. I put his heels under a half foam roller to put his heels into more plantar flexion. He felt fine. Bend over, no problem. Mm-hmm. All the other relevant movements, with the exception of maybe a left side bend, were okay. So forward bend, but okay with the half foam roller underneath. Left side bend was a little bit achy as well. So then I had him just stand, and I had him straight knees. I said, just bend your right knee, like you're just standing, bend your right knee. He said, that bothers me. I said, well, that's the position you were in most of the summer with your High School Musical. Then I said, just bend your left knee and keep the right knee straight. He said that was fine. So I was just kind of, I don't do that much. I don't have people bend their knees that much, but something with him, I needed to get at some form of hip drop or hip shift thing. And then I had him do the slump test, because I think that was probably going to be positive. He was so tight in his calves, he could barely even straighten the leg out. So, and his straight leg raise was negative. I wasn't sure if he was compensating in the slump test, but he's 12, and I don't know if something like that would have been a false positive or a negative. So my clinical reasoning after the eval was that it was something from a chronic postural issue over the summer, that it could be lumbopelvic. I wasn't quite sure. All I know is that when I took his feet out of the picture, both feet, his lumbar forward bend got better and he felt better. But then he walks out of here lifting his left heel up, okay? So the first visit, he said he felt a bit better. And I did a lot of neurodynamic things with him. I had him do some walking with just moving his arms, just trying to just get some blood flow. I said, walk on your heel, move your arms. How does that feel? I said, cross midline. I remember in one of the classes I took with David Butler, they always said crossing midline refreshes like the homunculus or something. Does that make sense to you, right?
Yeah.
So he did that. He felt better. And I did a little bit of work on it, manual work on his back, but I just know him from prior, the prior time. So it's very similar. So I did a lot of gait work. And he was still walking. He kept saying he was feeling better, but he was still walking on his toes. Then I just saw him last week, and the father said that he runs around with the kids and has no problem, and he feels fine when he's doing that. But when he comes in here, he gets into that pattern. So I wasn't really sure. I was a little sort of confused. I wasn't sure because he likes to come here, and I don't know if he's sort of feeding into that pattern when he comes here, because the father's like, he runs around with the kids and he's good, and then and they drive here, so when he goes up the slope in the parking garage, he said he felt it. I didn't really want to go down the same route because I know this kid, and the father had mentioned that he was just so much better when he was playing with the kids, an element of distraction. So I started having him do some walking with wide basis support, things like that with the yellow bands, and he was better. So I want your thoughts on what do you think of the presentation, knowing the background, and then also in terms of the gait dysfunction, how we can remedy that with the element of not having him hop on a table here, because I don't think he needs it at this point.
Right.
So, you let me know.
Yeah. So what I find interesting, first of all, is that a year ago, something led you to treat the neural tension aspect from the T-spine for knee pain. What led you down that path?
Because he's not, he's an only child, number one, and I'll tell you something why. His mother married late. He's basically an uncle, and he's not like your typical kid who does a ton of sports. He likes a lot of art history.
Mm-hmm.
He does a lot of reading. He's a very sensitive child, and
Mm-hmm.
the way he was speaking to me, the way their mother was speaking to me, I ended up going, let me just check the thoracic spine, and he was really sore, which is not normal in that age group.
Right.
Right?
Right. So you treated the neural system before. He returns a year later, and the neural system seems a lot more complicated.
Yeah.
In its expression, because before it was just the knee pain. Now it's the hip and the back and the leg. And it's interesting that he actually wants to go up on his toes to alleviate it, which makes me think neural tension.
Right.
Which is
right.
what you thought, obviously, because he's like trying to alleviate that, but not really a nerve root issue because he can go up on his toes. So the strength is there. He hasn't lost strength and those types of things. So we have to kind of think away from like something maybe impinging on the nerve root, but what is giving him all that neural tension, since you kind of found some of that before? And why is it only on one side? Because my first thought when you were describing this young man, my first thought was, how much has he grown in the last year?
Yes, not a lot.
And is he and is he experiencing a tethered cord?
Yeah.
So it makes me kind of wonder about that a little bit.
Yeah.
And it could be, but it seems, like any kind of pain expression, it can be transient, when he's with his friends and running and doing whatever he wants to do. It's not an issue. Do they see this show up any other time except when he comes to therapy?
No, he actually does walk on his toes, the father said, a lot, on his left foot. So he puts the right foot down normally at home. And it's like going up the hill from the parking garage here in the city. So because that'll bother him.
Mm-hmm.
But when he's active with other his stepsisters and brothers, he seems fine, but he's distracted and
And we all know with pain, and the evidence we have with pain is that there's different, it's complex. Some things can, give us reason not to have a pain expression, and other things can kind of feed into the expression of pain for sure.
Yep.
But like I said, the thought that I had, because it doesn't seem like it's probably a nerve root involvement, because again, he can go up on his toes. It sounds like he's wrong. It's not like he's falling out or weak or he doesn't seem terribly clumsy. So things that you would kind of want to be ruling in and out, and it doesn't sound like this. You're not seeing anything like ataxia or clonus or anything that might lead you to thinking something in the thoracic spine.
No.
As well, like space occupying lesion or anything, which are kind of rare at this age in that group, but can be there nevertheless. Does he have a history in his background? Does the family have a history of ankylosing spondylitis or any kind of process like that going on? Are they Scandinavian by descent, by perchance, or
Italian and Irish?
Are they tall, lanky people, or
no? And he's not that tall, actually.
Mm-hmm. Is this that tall, or
average? Last year, so that in 2016, he grew about 6 inches last year, which is why I think we had the knee issues and things like that. But when I had him take a yellow band in his hands, I'm using my hands again here.
I love it.
And just hold it, just take a yellow band and just sort of put tension on it, hold it in your hands, have your wide base of support, and he was fine. Tell me, that's shutting down something? I don't remember what it is. Isn't it when you have your hands wide and then you have your wide base of support, you're taking tension off some part of the system and then on. Does that make sense?
Loading up another part of the system.
Right.
So
right.
You're bringing the attention up into the upper part of the central, not the central nervous system, but the peripheral system.
Peripheral system.
And can unload it. I like the idea too of the wide-legged stance, because that changes the load on the neurological system, whatever way we want to call it. If we don't want to pin a diagnosis on it, we can still talk about loading the neurological system in different ways. And I love the fact that you actually put the band in his arms and not on, and, I know you did it some on his legs, but I think we forget that we can load the upper extremities and make some changes there, and that affects the neural tension and the neural changes
Right.
in the lower extremity as well. But the wide base is kind of a nice thing, because you can get, if he can stand that way, then he can begin to bring his feet in to the point of where does it begin to bother you? Now go back out again. He can start using that as a neural tension treatment. Like, okay, so if it's bothering you, stand with your legs further apart until it doesn't. Find that spot, hang there, move, do whatever, you want him to do. Play your video games that way. Do, whatever. And, but every once in a while, bring him in a bit and then, snuggle up next to it, but don't push into it all the time. And then come back out again, and he can work on that as a way to kind of get that neurological load to begin to maybe get some mobility through that, or decrease the sensitivity. I don't know if it's a mobility or a sensitivity issue, but it's all going to be treated the same, right?
Right.
To decrease whatever it is that, his symptom expression.
Right.
Because I know when we really load up the neurological system for neural tension, if you get them all the way flexed over and their toes are pulled all the way back, and you even twist their trunk and put their arms up into the upper limb tension thing, and nothing happens, that the next thing you do is cross midline.
Right.
To bring it on, right? Because that's where you're really going to start pulling that in. And so, wow, if he has to go outward to make it better, then that starts making a little bit more sense to me.
Right. So he literally, I just had the band in the hands, and I just had him, I said, walk like you're, really wide base of support. And he literally, the heel just went down, and I'm sitting here thinking, how did that affect him? I'm trying to analyze everything. What part of the nervous system, or how did that offload his nervous system so he could put the heel down and walk? And so his crack to me is, whoa, I'm going to walk that way forever. I said, no, you're not,
It's just a robot walk.
Right, exactly, right? So I was trying to explain that to him, and I said, it offloaded some tension in your system by taking, I was trying to half making this up because I wasn't expecting his heel to go fully down. When I did that, I figured if some change would be affected, but he literally had no problem. He was pain-free.
I think it's interesting because when we always think about, the compression or the loading coming from underneath the feet up. And we forget about, or at least I do, oftentimes with my clients, that I can unload them from above. And my question to you is, back to you as we're kind of discussing this, is perhaps maybe when we grab the band, I'm using my hands too, and I'm pulling apart.
Yep.
And that, what is that activating? That's activating latissimus, it's activating, trunk muscles, it's activating the anterior abdominal wall. I mean, maybe even multifidus somewhat, whatever. It's turning things on up above, perhaps.
Yeah.
And maybe that's creating kind of a lift or an unload to that tension system below.
Right.
Because he has to, because it's kind of pulling him up. What would be cool? I just thought of this. I didn't finish my sentence. So it's probably pulling him up off of, his lower quarter. But what would be interesting is if he actually put his hands on a chair. You know what I'm talking about? Get your hands on the arms of a chair and lift up and unload.
Yes, like a decompression.
And see, either with elbows or hands, whichever he feels good about doing.
Yep.
If he could do that every so often, even standing at a countertop or a desk. I'm going to stand up here where Erica can see me, and I'm putting my hands right on the desk in front of me, but even just, pushing down through to unload just enough.
That's a great idea.
Give him a chance to get his heels on the ground.
Great
in
idea.
a different way.
Yep.
So that would be really interesting to see, because I think that would help. And can he start it with his legs out, and can you bring them in some? I mean, there's, so you'll have some ways to kind of play with the variance in the system there.
Yeah, because remember, I think this was one of our first podcasts, or second podcast, you talked about, and this is what I learned from you, doing the lumbar range of motion, knees, changing base of support, wide and narrow. And I think that's such a great idea to do with everything.
Mm-hmm.
And that's why I did it with this kid. I was like, well, let me just see this, he's got to be, we have to try something to get this kid's heel back on the ground.
And to make him understand that it's okay to put it there.
Exactly.
That it's not just, it may be positional. It may not be the fact that my heel's not on the ground.
Right. And knowing that how I treated him before, I was trying to be sensitive to that as well. So going forward, I think for him, I mean, I've seen him now. Let's see. I haven't seen him since last year. I don't think they're coming in this week, but I'm going to do a lot more of the gait, bands and the support. And I also almost want to do just upper extremity. I'm using my arms like David Butler, sort of median nerve radial, whatever, because he walks.
Mm-hmm. Or for somebody who might be listening that understands P&F, just diagonal work, right? Because that's what those are. Those neural tension things follow the diagonals.
Totally. Exactly. Just novel movements.
But what will be really cool, Erica, is also the ones across midline.
Yeah.
So, like taking the right arm and reaching it up over towards the left ear behind the, in front of the face, and then coming down and out so that you've got midline crossings, to kind of help that system go back and forth across midline a bit.
Yep.
And I love the idea of active movement and all of that stuff with him rather than trying to passively stretch and do,
Yeah. No, it's interesting because looking at the history, let's say he just came into me this for the first time and I didn't know his history, the fact that he was offloading his leg by just lifting up his heel, and then just me sticking a half foam roller under his heels unloaded everything. What's clearly something neuro, and not in a sinister way, is going on here. And at this age, it's not quite so normal. However, I did do a little bit at the beginning of some hands-on, and I just quickly got out of that. I mean, I did a little, but I realized that he needs to move, and he needs to move differently.
In novel ways,
And I think that's the motto here, or the moral here, because when he's moving in novel ways, playing with his friends and his right at school, he's putting his heel down because he's moving. He's all over the place,
right?
And he's not an athlete, but that's what
he's
he
still
does.
Supposed to move. You don't have to be an athlete to not move. Right?
Exactly. So he's not sitting there doing soccer after school, not at all. But so what he does, run on the beach, he does those things, and he can put the heel down. But what's interesting, when the father said he was going up the parking garage, up to the hill, it bothered him, and I said, well, I mean, that's uphill.
Yeah,
he's got to put his foot down for sure. I mean, it's hard to go up a hill on your toes. So, I didn't really have quite a great answer for that, to be honest. But I said I wouldn't worry too much about it at this point. But I think that he just needs to take himself out of context. When he's in different context, his brain changes, and he can forget about whatever else is bothering him, and his nervous system just adapts.
Yeah, so I think that would be kind of fun. I don't know what he does for fun, if he does do video games, or he likes his computer or YouTube videos, or
he likes artwork. He likes art.
Artwork is great. Does he paint? Yep. Does he draw? I mean, it'd be great to get him in a whole bunch of different positions while he's doing that on his feet, because he probably sits to do it, and he may not stand to do it. So the challenge would be, I want you to do your art, but I want you to do it in 5 different ways, and only one of them can be sitting.
So
find a bunch of ways to work, even laying down, but standing, and find, a few ways to stand that you can, and he'll get into his art, and the only thing he needs to pay attention to is, how can I get myself in a position where I feel good and my feet on the ground? And there isn't any other rules but that. So if he needs to stand out, if he needs to cross midline, if he needs to twist up, if he needs to stand on a towel, if he needs to whatever, but that might be a way to kind of pull those things together so that it's not an exercise. It's just doing the things he loves to do.
Right.
Just challenging his system to do it in a different way.
Yes. And what's interesting as well, I just had a note here I wrote down, I had him walk backwards.
How did that go?
And he was fine.
Isn't that interesting?
I just saw that in the eval, and I was like,
oh wow, I think that feeds into what we were talking about then. Yeah. It's very interesting. All of a sudden, it's like, why is that different?
Right.
No,
Right.
why would being able to, so is it a forward moving flexion thing that doesn't
Mhm.
allow the heel to go down and it goes backwards and it goes into extension so it's easier?
Mhm.
Less
Mhm.
tension perhaps? Or is it a funky movement that the brain is like, wait, whoa, we're doing something different. Okay, put your foot down so you don't fall over. I don't think,
Mhm.
maybe both,
Right.
right?
Right. Right. Right.
It's
And the
so
funny thing,
funny.
I know it is because and in the summer when he was in the High School Musical, he's dancing, he's moving, he's just doing these different things. Didn't bother him at all. And then when he stands still from 8 to 5 at a local fair, 5 days later he gets it. So
Hmm.
I think this kid loves to move, whether he does
Wants
it
to or not.
exactly, or
Or
whether
does it
he's in
athletically,
formal,
yeah.
exactly, a
Yeah.
formal program. So I think the motto of something, as I keep saying, the moral is, especially you need to check different things, and in the evaluation is to just do different and novel things. I did the lumbar forward bend because I wanted to take his heels out of the picture. That's the only reason I did it.
Hmm.
And that gave me a lot to go on. And just because you don't really see a kid walking in here walking on his left toe. It's just not like a normal presentation.
Exactly,
So
and especially for a 12-year-old.
right.
You
And
know,
yet,
you see an
yes,
adult doing that, you start immediately thinking which joint's in trouble and what do we need to do?
exactly.
Why do we think
Exactly.
that way? But we don't with a 12-year-old because generally they don't have issues like this.
Right.
I love the other part of that you brought it back to thinking outside the box. But for the people who are listening that are figuring out physical therapy and following their algorithms, that they're learning and all of that, is that you actually follow. Variation in practice isn't the fact that you followed the right tests and measures to do. You still did forward bend, you did side bend, and you did extension. You figured out which quadrants or which planes of motion were going to be problematic for him,
Mhm.
and you tried to recreate his pain in some different ways, which is
Mhm.
following the PT algorithms.
Yep.
All you did was immediately after forward bend change and let me put something under your heels, and then we'll do forward bend again. Did that change it?
Yes.
So that's
Yep.
kind of where you started interjecting and kind of at least I think from what I heard
Yes.
from you,
Yeah,
you
for
started
sure.
pulling those things in and doing. And I think for the people that are listening, you still did a dural stretch, so it may not
Mhm.
be a dural issue.
Right.
You can have
Right.
neural tension without maybe having a dural issue,
Yep.
perhaps.
Yep.
Does the nervous system have to be sensitive all the way up and down? Not necessarily.
No. No.
Maybe the sensitivity part of it, the expression of it is just down in the leg and may
Yep.
not really have anything to do with the sitting. And forward bend and standing is different than sitting because they can cheat. They can rock back on their pet, and drop their trunk down and do
Mhm.
different things and not really get in a forward bend that happens at the hips,
Mhm.
and brings that back into a different position. So, and then the straight leg raise wasn't going to give enough
No.
because you
Mm-mm.
probably had to take it way up to make it
Yeah.
happen. And then again, you weren't loading, you weren't
No.
standing kind of maybe in compression or
Yep.
against gravity. So all of
Yep.
those things are important, but they don't all have to like ring the bell. You'd have to look for where's the cluster? What am I finding? And what makes the most sense from that cluster?
Right. And it's almost like a pattern recognition as well.
Yeah.
But so I was just playing with bending the right knee, bending the left knee. Sometimes I
Mhm.
think people who are listening, be a little bit creative, even though you're doing all of
Mhm.
these planar movements. Do a little right, left bend, side to side, and see what it does to their system. And I think you'll glean a lot of that, a lot from the story, as well as just these novel inputs into their system after having done your actual movement test that you were supposed to do and that you're learning in school as well.
Mhm.
So with him, I mean, I think I've got a lot on him now. So uh, he's, I think he's going to be okay. I'll
Yeah.
probably see. I think I'm seeing him next week, and I'll certainly report back. And this is great. I
Yeah, he'll
mean,
be an interesting one to
fabulous.
follow too
Yeah,
down the road, and it's great that you've established this relationship with him and his family,
yeah.
because if this continues to be the cyclical thing,
Mhm,
kind of
mhm.
like what's going on now around that, and or is it related to growth, or is it something else that maybe there's a couple of little red flags that need to be kind of checked out further? Is there an autoimmune thing going on, or is there, like I said, I hate to even use the word tethered cord because people, I think, overuse it. Everything's a tethered cord these days.
I know.
And it's like, no, maybe not, but, just kind of like thinking, just as you kind of, just those are things, hints in the back of your head right now. But that's what's kind of cool about being able to follow somebody along the continuum, is because you know him.
Yes, and it's interesting because...
And that helped you with this treatment cycle right now, because you have a history with him from when he was 11.
Yeah, literally almost a year to the date.
Mm-hmm.
Okay, he came in...
That's interesting, too.
Yeah,
wow.
yeah. So I'm like, what's going on every fall? Our school,
We have preschool anxiety? I know. What's happening? So
it's crazy, but this is great. So I will, and plus he has the allergies too, and I'll talk to the mom or the dad next time they come in. But I think I'm on the right path here. So
absolutely,
yeah. It's very cool.
Yeah,
awesome. Looking forward to the next one.
So I will bid you adieu.
Yes, as you as well.
Thank you, everybody, for listening. We have so much fun when we do this. I learned so much from Erica, and it is such a great thing to sit and take notes and be able to reflect back and ask questions. And thank you for sharing this one with us today.
My pleasure.
And we'll see you all in future podcasts. Thanks so much.
Thanks, guys.